ChiroSecure Research Update. A study published in the Journal of Manipulative and Physiological Therapeutics to evaluate whether a seated, retracted, extended, and compressed position would cause tension in the anterior cervical ligament, anterior disc, and muscle structures, and thereby restore cervical lordosis or increase the curvature in patients with loss of the cervical lordosis. 30 pre-selected patients, after diagnostic screening for tolerance to cervical extension with compression, were treated for the first 3 weeks of care using cervical manipulation and a new type of cervical extension compression. This study concluded chiropractic biophysics techniques, extension compression, two-way cervical traction, combined with spinal manipulation, decreased chronic neck pain intensity, and improved cervical lordosis in 38 visits over 14.6 weeks, as indicated by increases in segmental and global cervical alignment. Anterior head weight bearing was reduced by 11 millimeters, Cobb angles averaged an increase of 13 degrees to 14 degrees, and the angle of intersection of posterior tangents on C2 and C7 averaged 17.9 degrees of improvement.